Good evening and a warm welcome to this episode of Visite this Sunday evening. And thank you also for the valuable questions you sent me. But what I actually haven't even done yet in all the Visite episodes is to really thank you from the bottom of my heart for your kind words about this series. And I gather from this that it is an important time for you to learn more and to understand things that make it possible for you to implement them in everyday life, and maybe sometimes helps not to feel at the mercy of being confronted with a diagnosis or a state of health. In any case, many thanks to you for that. And today I want to discuss a topic which a 56-year-old lady from Aachen sent me. This is Beta, and Beta writes that her symptoms are a very strong pulsation in the upper body. It starts from the abdomen and goes up to the neck. Then the heartbeat climbs up to 100. And everything that has happened so far in terms of diagnostics, whether the ultrasound was from the abdomen, thyroid, intestines, lungs, they couldn't really find anything but this high pulse. She writes, I have run out of energy and strength by now and have no appetite at all because the pulsation doesn't let me sleep either, of course. I can understand that well. She writes in a nutrient test, 2 values were measured as high. One was the ferritin value with 193 and the vitamin D value with 354. However, no therapy was initiated, and the question is, can you help me? When I read that, Beta, then of course, first of all, the question is about these 2 laboratory values. Because a ferritin value of 193 would be, theoretically, not be too high. The question now is, of course, which unit of measurement has been used here? You can then discuss that again in very concrete terms. First of all, I would like to assume whether this value is pathological or not. If we want to make a statement about the iron metabolism at all, then we have to have the specific ferritin level and not the iron level. You have now done that, and I assume that it is actually not increased. But what strikes me a lot is your vitamin D with 354. I think that's nanomoles per litre in this unit. And unfortunately, you have not written whether you also substitute or how it comes to such a high value. An average vitamin D value is about 100 to 170 nanomoles. This unit of measurement is given theoretically. And we also want to see patients with a good value around 140 to 160, 170. So how much do you substitute? Because if you're at 354, you're almost twice the norm. And a lot is not always good. And that is why the question needs to be asked, do you substitute or don't you substitute? If you no longer substitute, then the body cannot use this vitamin D at all. We always measure the 25-OH vitamin D, which is the inactive one. And our body must be able to convert that. It does this with the help of UV light into the active vitamin D. And then you have to have a receptor to which the vitamin D can dock. Maybe that vitamin D accumulates because you are substituting and don't metabolize the vitamin D further. But why is vitamin D necessary? And I wrote down a few thoughts about it. to explain this to you in this context and what I would be looking for if I was in your shoes. Whenever vitamin D is very high, all doors open to calcium in our intestines. Calcium is one of the most important minerals for the nervous transmission of impulse. We need an incredible amount of calcium for cell communication and for the bones. We know that all of our appendage glands, everything needs calcium. But this calcium that you consume every day has to get into the body, and you can't do that without vitamin D. But if you are someone who likes to drink a latte macchiato every day, and by that also has a certain amount of milk, who is an advocate for cheese, if you like to eat yogurt, I mean the dairy products now, then you also have an increased amount of calcium every day, more than if you had low vitamin D levels. Then the same would not be the same, but now you're opening all doors in the intestine. For example, the consequence of hypercalcemia would be that the calcium would crystallize out to the kidneys and you'd get kidney stones in the long run, for example. But maybe it's not that far. Maybe it's actually the state first, that we have too much calcium in the system at once. And what our body regulates incredibly sensitive for itself is that it reacts to an excess. So if it has too much calcium, it needs more from its opponent. And that's magnesium. Calcium always means that if there is too much calcium, then something becomes tense. Then I have a cramp. And you know, when you take magnesium, then the cramp subsides. That means calcium then binds more calcium, especially at the muscles and nerves, to rebalance the intracellular balance between calcium and magnesium. This is the body's first response to this calcium excess. What is the result if I then bind the magnesium? That there is an overall deficiency in magnesium for the body. But if there is no longer enough magnesium in the system, then the nerves are activated. Then the muscles are tensed. Then the nerves fire. Then they get excited. People can also get cardiac arrhythmia. We have a rhythm disturbance here. The pulse goes up. That is the heart rate. We often have insomnia in patients. We have states of excitement. And if that's the case, then of course this reduced magnesium has to be compensated in some form by the body by stopping the excretion. That is now the job of the adrenal gland. The adrenal gland, which of course produces the stress hormones for us, adrenaline, cortisone, slows the excretion of magnesium so that magnesium is stored in the body. According to the motto, we have a high consumption at the moment and you all have to stay. Don't leave us. So with a lack of magnesium, a high activity of the immune system, just as if the adrenal gland goes down in its performance, can no longer be sustained. The patients can then no longer cope with stress so well. You develop a stress intolerance. Because, of course, what gives us such a counter-regulation against inflammation, what makes us calmer, is cortisone. And the cortisone is being regulated down at this moment for our protection. But when the adrenal gland is also decreasing in its performance, then it is ready to excrete more potassium and sodium as a counter-regulation of magnesium. Do you know where we need sodium? In the stomach. Our hydrochloric acid, that is sodium chloride, is formed from sodium by the parietal cells of the stomach. But when the stomach acid subsides, I have less disinfection. So the acidic pH value that arises in the stomach has the responsibility to clear everything in advance before it reaches us. By that I mean before it goes from the stomach to the intestines and from the small intestine to the body. A decreased stomach acid with a low immune capacity increases the risk that parasites will gain the upper hand. And if now parasites get the upper hand, then my digestive problems slowly grow. Heartburn too. And I hope and do not wish that you will react immediately with Pantazole, because we have too little stomach acid, and Pantazole, as a stomach protector, causes long-term vitamin B12 deficiency. The metabolism of amino acids or proteins is also influenced by too little stomach acid. But if I can't break down enough proteins into amino acids, then I cannot build enough physical substance from the building blocks. This includes hormones, for example. This also includes neurotransmitters. Neurotransmitters, by that I mean dopamine, for example, for Parkinson's, or tryptophan as an amino acid that is further metabolized, or the many others that I need for the regulation and functioning of our entire neurovegetative nervous system. The result is weak drive, loss of energy, mood swings, and also fears. So if the body no longer has enough sodium, then the electrical membrane potential also decreases. That is the level of communication from cell to cell. This means that the ion exchange can no longer take place 100% here. But then, of course, the proteins and blood sugar can no longer be metabolized, and the cells are almost starving for nutrients. In addition to sodium, this also applies to potassium. When potassium reserves run out, and especially our heart has a great need for potassium and magnesium. When potassium is depleted and a measurement is made, for example the ratio of potassium and calcium, then the thyroid cells can become resistant to the thyroid hormones. The thyroid cells become resistant to thyroid hormones, and with it the metabolism can regulate itself. What is the consequence? Very much what we now call so-called diseases of civilization, whether that's the blood pressure, heart disease, hypothyroidism, chronic inflammation, or burnout. So I would recommend that when you have that really strong pulsation, you should pursue these things on a different level. You can measure calcium in a 24-hour urine, for example. Please also measure the parathyroid hormone. The parathyroid hormone has an indirect influence on this metabolism from vitamin D and calcium. Electrolytes such as sodium, calcium, but sodium and calcium are also measured extracellularly, so in the serum, while potassium and magnesium are measured in whole blood. This is a very important distinction because you need to know how much potassium is really available to the cell. And that would be important on the part of the mineral situation. And also in the evaluation of high vitamin D levels. The second consequence is, of course, that you may come across a topic that you do not even recognise, namely the binding capacity of the vitamin D receptor. I am shocked to see how many people have vitamin D receptor binding weaknesses. And so, of course, vitamin D is not able to clear things up for the organism on an immunological level. This is a situation that you should clarify, please. But of course, you go step by step. The other thing is to understand this pulsating and strong, how shall I put it, restlessness in your body in the context of the interference field problem. In other words, do you still have impacted wisdom teeth? Remember a patient who still had impacted wisdom teeth? And these impacted wisdom teeth are related to the heart and small intestine meridian. And a striking symptom was a very high tachycardia. So the heart suddenly started beating incredibly quickly. The patient was then, of course, put on beta blockers that had reduced her heart rate. But the beta blockers made her very tired, and she really wanted to finally know why she had suddenly developed this fast heartbeat. And in that case, it was the two lower wisdom teeth that have been there for a lifetime. But we say in neural therapy, wisdom teeth can also become an interference field when the body loses the balance on another level. And that was the case with the patient. There was a heavy, how should I put it? There was a serious conflict in the family that caused loss of strength and nerves and other incidents that were not very nice, that she had completely lost her balance on that level. So please think about your teeth too. Think about scars too. And another concern of mine is that our entire conduction system leads over the spine. And what is there? What tensions are there? Paravertebral muscles. Are you under great pressure? Especially the segments of the thoracic spine that supply the heart, that supply the thyroid, that supply the upper abdomen. Is there a permanent blockage in the back? Anyone who is osteopathically versed can diagnose this. Also, thorn therapists can help with the regulation there. Or neural therapists who work with procaine can then resolve these regulation blockages. So there is a problem that has arisen. Everything has its causes. Everything only comes to the symptomatic level when the body really loses its balance, when its compensation is no longer enough. And I think you should pursue these things very specifically and consciously. so that you understand why the body is under this great pressure at the moment and simply does not come to rest. I hope that you will now implement this advice for you, and I wish you from the bottom of my heart, first of all, a wonderful evening to everyone, a good week, and I am really looking forward to next Sunday with you. Goodbye. Dear viewers, the preceding episode is an indicator for her holistic medical approach and does not replace visiting your family doctor. Thank you.